Hey cat lovers! Today we're diving into an important topic that every cat owner should be aware of, recognizing when your feline friend isn't feeling their best. Cats are masters at hiding their pain, but as their guardians, it's our job to decipher their subtle cues and advocate for their well-being. We'll be discussing 5 signs that your cat may be sick and what you can do about it. Remember, we're not playing veterinarian here, but knowledge is power. And knowing what to look for can mean the difference between a minor scare and a major health crisis. So let's get right into it and empower ourselves to keep our feline companions happy, healthy, and thriving. All right, let's talk about food. We all know cats love their food, right? They're like tiny, furry little gourmands. So any change in their eating habits should be a big red flag. Has your furry friend gone from gobbling down their kibble to barely touching it? Or maybe they're suddenly ravenous, always begging for more food, but still losing weight. This, my friends, is not normal. It's not just a phase, and it's definitely not your cat trying to manipulate you for extra treats. Sudden changes in appetite can be a sign of a whole host of health issues, from dental problems and infections to kidney disease, diabetes, and even cancer. Think of it this way. Your cat's body is like a finely tuned machine, and any disruption to their normal routine, especially something as fundamental as eating, means something is off kilter. It's like a wrench thrown into the gears, and ignoring it won't make it go away. Now I know what you're thinking. Jackson, my cat skips a meal sometimes. Should I be worried? Look, a single missed meal here and there, especially if your cat is otherwise acting normal, might not be cause for panic. But if you notice a consistent pattern of change, whether it's decreased appetite, increased hunger, or even just a change in their food preferences, it's time to call in the big guns. Your veterinarian. Remember, you know your cat best. You see them every day, you know their quirks, their routines, their little personalities. Trust your gut. If something feels off, it probably is. Don't wait for things to get worse. Early detection is key, and a simple checkup can save you and your cat a whole lot of heartache down the line. Okay, folks, let's talk about something we all deal with as cat guardians, the litter box. It's not glamorous, but it's a vital window into your cat's health. Changes in litter box habits are not something to be ignored. They're often the first and sometimes the only outward sign that something is amiss. Think of the litter box as your cat's personal bathroom diary. And trust me, you want to be reading between the lines, or in this case, the clumps. Is your cat suddenly peeing more frequently, straining to urinate, or even having accidents outside the box? These can be red flags for urinary tract infections, bladder stones, or even kidney problems. And what about those presents they leave behind? Changes in stool consistency, color, or frequency can also point to underlying issues. Diarrhea might signal dietary indiscretion, parasites, or inflammatory bowel disease, while constipation could be due to dehydration, stress, or even a blockage. Now, I know some cats are just naturally a little particular about their bathroom habits, but any significant change from their norm, especially if it's accompanied by other symptoms like lethargy, vomiting, or changes in appetite, warrants a trip to the vet. Don't fall into the trap of thinking, oh, they'll be fine. It's probably nothing. Cats are masters at masking pain and discomfort. They're hardwired to hide weakness, a survival tactic from their wildcat ancestors. So by the time they're showing obvious signs of distress, the problem may have already progressed significantly. Remember, you're your cat's advocate. They depend on you to interpret their signals and get them the help they need. So pay attention to those litter box clues and don't hesitate to seek professional help when needed. We all know cats love their naps. They're practically professional nappers, right? But there's a big difference between a well-deserved cat nap and excessive lethargy. If your usually playful, energetic feline suddenly transforms into a furry couch potato, it's time to pay attention. Think about it. Cats are natural predators, hardwired to hunt and explore. Their instincts tell them to conserve energy for those bursts of activity. So, when they're choosing to sleep over chasing that laser pointer or batting around their favorite toy mouse, it's often a sign that something is zapping their energy reserves. Lethargy can be a symptom of a wide range of health problems, from minor infections and stress to more serious conditions like heart disease, kidney disease, or even pain. Imagine feeling so lousy that you just don't have the energy to do anything but sleep. That's what your cat is going through. Now, I'm not saying that every time your cat takes a long nap, you need to rush them to the emergency vet. But if you notice a significant change in their activity level, especially if it's accompanied by other symptoms like loss of appetite, weight loss, or hiding, it's crucial to seek veterinary attention. Remember, cats are masters at hiding their pain. They've evolved to mask weakness as a survival mechanism. So by the time they're showing obvious signs of lethargy, the underlying problem might be more advanced than you think. Don't dismiss their lethargy as just being lazy. Trust your instincts. You know your cat best. If something feels off, it probably is. Early detection is key to providing your cat with the best possible outcome. We all know cats are meticulous groomers. They're like the fashionistas of the animal kingdom, always primping and preening to keep their coats looking fabulous. But what happens when their meticulous grooming routine goes haywire? What does it mean when they're either over-grooming to the point of bald spots or neglecting their usually pristine fur? Well, folks, let me tell you, it's usually not a good sign. Changes in grooming habits can be a major red flag that something is amiss in your cat's world, both physically and emotionally. Excessive grooming, sometimes to the point of self-inflicted wounds or bald patches, can be a sign of stress, allergies, parasites, or even underlying pain. Imagine having an itch you just can't scratch, or feeling a constant burning sensation on your skin. That's what your cat is dealing with, and their way of coping is often through excessive licking, chewing, or pulling at their fur. On the flip side, a sudden lack of grooming can be equally concerning. Cats who stop grooming themselves might be suffering from dental problems, arthritis, obesity, or other conditions that make it painful or difficult for them to reach certain areas of their body. It can also be a sign of depression or other emotional distress. Think of it this way: grooming is a cat's way of self-soothing, of maintaining control in their environment. So any significant change in their grooming routine, whether it's an increase or decrease, is a clear indication that something is out of whack. Don't ignore these subtle signs. Pay attention to your cat's grooming habits, and if you notice any drastic changes, don't hesitate to consult your veterinarian. Early detection and intervention are crucial to addressing the underlying cause and getting your feline friend back to their usual well-groomed selves. We've all heard the saying, "You are what you eat." Well, when it comes to our feline friends, it's more like you are how much you weigh. Sudden or unexplained weight changes in cats are never a good sign. They're often a telltale indication of an underlying health issue that needs to be addressed sooner rather than later. Think of your cat's body as a finely tuned instrument. Every ounce, every gram plays a role in their overall health and well-being. So when that delicate balance is disrupted by sudden weight loss or gain, it's like throwing a wrench into the works. Unexplained weight loss, especially if it's rapid or dramatic, can be a sign of a whole host of problems, from hypothyroidism and diabetes to kidney disease, cancer, or even dental issues that make eating painful. Imagine feeling nauseous or experiencing constant discomfort every time you try to eat. That's what your cat might be going through, and the weight loss is simply a symptom of the underlying issue. On the flip side, sudden weight gain, especially if it's not accompanied by an increase in appetite or food intake, can be just as concerning. It could be a sign of fluid retention due to heart disease, liver problems, or even certain types of cancer. Now, I'm not saying that every fluctuation in your cat's weight is cause for alarm. Cats, just like humans, can experience minor weight fluctuations due to changes in activity level, stress, or even the seasons. But if you notice a significant or persistent change in their weight, especially if it's accompanied by other symptoms like changes in appetite, energy levels, or litter box habits, it's crucial to schedule a visit with your veterinarian. Remember, early detection is key to successfully treating many feline health conditions. Don't wait for the problem to escalate before seeking professional help. Your cat's health and well-being depend on your vigilance and proactive care. So there you have it, folks. 5 crucial signs that your cat might be trying to tell you they're not feeling their best. Remember, early detection is key to keeping your feline friend healthy and happy. Cats are masters at hiding their pain and discomfort, so it's up to us, their guardians, to be vigilant and attuned to their subtle cues. Don't dismiss any changes in their behavior or routine as just a phase. Trust your instincts. If you notice any of these signs, don't hesitate to reach out to your veterinarian. Thanks for watching, and don't forget to like, share, and subscribe for more cat care tips. Let's work together to keep our feline companions happy, healthy, and thriving for years to come.